Well, good morning, Mississauga. I'm Brad Butt, the Vice President of Government and Stakeholder Relations with the Mississauga Board of Trade, and it's my great pleasure to welcome all of you to this very timely and important webinar today. Today, we will be providing you, our members, with a webinar on safety insights for getting back to business during COVID-19. I'd just like to quickly review the virtual event protocols for this call. All attendees will remain on mute as we are recording this event. A Q&A session will occur after the presentations. And if you do have a question, please use the Q&A button, which is at the bottom of your screen in the middle, and simply type in your question. The questions are only visible to MBOT staff and our panelists. We will certainly vet those questions, make sure that they're appropriate in content, and make sure that we get to as many of those as we can within the time frame that we have today. So today we're very fortunate to have two guest speakers, Stella Nicastro-Greenough and Vicki Waldick, who will provide businesses with important information and recommendations for safe work practices to keep your staff and the public safe while working during COVID-19. The Workplace Safety and Prevention Services is a nonprofit organization that is part of the Ontario Occupational Health and Safety System, primarily focused on the service, manufacturing, and agriculture sectors. WSPS offer health and safety expertise, consulting, training, and resources. Stella Nicastro-Greenough is a small business regional community coordinator with WSPS and has over 13 years experience assisting customers with their health and safety needs. Stella collaborates with small businesses and community organizations in the Central West region to ensure they have access to the information, tools, and resources they need to work safely. Vicki Waldick is a regional community coordinator with WSPS as well. She has a background in law and human resources. However, the past 6 years of experience have been focused on the health and safety industry. Her focus is primarily in helping small business owners in Ontario with easy, accessible tools and resources to get them started. She also connects with various communities in her area to share the many simple safety solutions that WSPS has to offer. So please join me, everyone, in welcoming our two speakers and presenters today, Stella and Vicki. Ladies, we'll turn it over to you. Thank you.
Thank you, Brad, and thank you very much to the Mississauga Board of Trade for having us on today. We're very excited to be here. So today, Vicki and I are going to talk to you a little bit about safety insights for getting back to business during COVID-19. And so, Vicki, if you could share the PowerPoint.
No, just waiting for it to go to slideshow mode. There we go.
Great. And next slide, please. So this PowerPoint is for information purposes only and is not intended to provide advice. The information is as current as the information as that we know today. For any specific COVID-related questions, we ask you to contact our duty consultant, which we'll talk more about in the presentation, or visit WSPS.ca, where we'll continue to update our COVID-19 page with current resources. So let's start off with letting you know about WSPS in case you've never heard of us before. So Workplace Safety and Prevention Services is a not-for-profit organization committed to providing Ontario workers and businesses with health and safety. We are a proud partner in Ontario's occupational health and safety system. We offer health and safety expertise, consulting, and training and resources. Our mandate includes helping businesses understand their risk and legal obligations and stay in compliance and build a safer workplace. And our vision is every worker healthy and safe every day. So COVID-19 is creating unique challenges for all industries. The public health issues resulting from dealing with the general public during the pandemic has changed the way that businesses must be done. So while highlighting new challenges to protect the health and safety of our workers. So today, Vicki and I are going to talk to you and focus a little bit about providing insights into safety issues during the COVID-19 pandemic, provide recommendations for safe work practices to keep your staff and the public safe while working during COVID-19, and then take your questions at the end. At this point, I'll hand it over to Vicki.
Okay, thanks, Stella. So the first thing that we're going to talk about is what we call the RACE model. This is how you kind of identify and try to mitigate or remove a risk or a hazard in your workplace. So RACE stands for Recognize, Assess, Control, and Evaluate. And the next few slides, we're basically going to go through each step and then give you some tips on how to kind of go about and do that in your workplace. So with recognizing the hazard, we've had COVID-19 around since about March with the state of emergency anyway. And so we know a little bit more about it. We know that it's a respiratory disease that ranges in severity. We know that it's transmitted through droplets during close unprotected contact with an infected person, or if you're touching an infected surface and then touching your eyes, mouth, or nose. And so recognizing how people will be able to potentially come into contact with COVID during work hours in your workplace, and then taking steps to minimize that contact is going to be the first line of defense. So the next step of the RACE model is to assess the risk. So in this case, it's the risk of infection. If you're going into your workplace and you don't do anything at all and just go back to the way it was pre-COVID, your risk of getting infected, of your workers getting infected, of the public getting infected will be much higher than if you were actually to put some kind of controls into place. So you need to put that into perspective in terms of what is the probability of it happening, what would the severity be of it happening, and that will determine what the consequence will then be and how high or low of a risk that'll end up having on your business. So that could also end up affecting your credibility as a workplace. It could also potentially affect your financial viability. If people don't trust you and don't think that you have good credibility anymore, they may choose to go elsewhere for the business that they want. And then that could affect you in very high level kind of ways. So you really want to try and mitigate the risk as much as possible. So the next step for the RACE model is controls. This slide is showing you the hierarchy of controls. So the one thing that we won't look into is substitution, because that is basically replacing the hazard. Unfortunately, with COVID-19, we can't do that. So we're only going to look at elimination, engineering controls, administrative controls, and then finally your last line of defense, PPE. Now we say that it's your last line of defense because we really do want you to try and implement the other top three types of controls first. PPE should really be the last resort. Now in this case, I know that we do have things like the masks being mandated to be worn in public spaces. So that does now require that we always have to have some form of PPE, but we really want you to focus in on the first three pieces of this and then kind of go to the PPE other than anything that is being mandated at this time. So kind of like what I was just saying, while you're putting these measures into place, make sure you're still in compliance with the Occupational Health and Safety Act, any emergency orders from the Emergency Management and Civil Protections Act, and any public health directives or guidances that are being issued by the Chief Medical Officer and the Ministry of Health, like the mandated masks. So the first control we're going to look at is elimination. Now, typically we would say try to physically remove the hazard. With COVID, we can't do that unless we all just stay bubbled in our houses and don't go anywhere, don't see anybody, don't do anything. But because we're trying to reopen, that's not going to be possible. So the next piece is going to be to eliminate the exposure as much as possible. You can't eliminate it completely, but you can try and lower your exposure as much as you can. So this would be things like eliminating the need for a face-to-face contact if that's possible. If you happen to have staff that could do their work from home while others absolutely have to be in the office or in the place of business, then maybe try to separate it that way so that you can have a little less face-to-face even just within your own workplace staff kind of community. Doing things like virtual meetings, especially when you're getting started, you can talk about what the new protocols are going to be, what the PPE is going to be, what kind of procedures you're going to have, all through virtual meetings using a platform like this one that we're on right now. That will eliminate some of the face-to-face, at least for the beginning, And then that way everyone will already be coming into the workspace knowing what they need to do without it being a confusion and then potentially kind of adding to the exposure possibilities. Allowing workers to work from home, if you can, is really going to be one of the best ways to do this, and we'll get into that a little bit more for other options as well. Isolating people from the hazard using physical barriers. So engineering is going to be this next control, and so physical barriers like a plexiglass if you're going to be at a cash register or something like that. I know for some hairdressers, they're kind of starting to put almost like a plexiglass or a curtain kind of barrier to try and eliminate a little bit that way and isolate each kind of seating station as much as they can. That way they can also help to avoid the face-to-face contact a little bit more in that capacity as well. And just kind of redesigning your workspaces to allow for appropriate physical distancing. So you might need I think they're called the decals, like the little arrows and stuff, to put on your floor to kind of show only one way to go a certain direction and only one way to go another direction, kind of like in the grocery stores with the way they did it in the aisles. You're going to want to think about things like when people are coming in, are you going to have someone standing at the door with the hand sanitizer? Do you want to just put a little station there with some signage to say, please sanitize your hands before coming in? Do you need signage to kind of remind people that it's mandated to wear a mask once they get into your place of business? Those kinds of things. So you're going to need to redesign your workspace a little bit in that capacity, and that would be the engineering control. The next one, this one's a little lengthy, but it is the administrative control. So you're going to want to update a bunch of your policies and procedures. The general health and safety policy that you hopefully have on your health and safety board won't need to really get updated other than the typical annual update where you sign and date with the New Year's date, and then it's good for 1 year. Other than that, what you're going to want to update are things more in terms of, what's it called? Just your general health and safety kind of policies for mentioning physical distancing, for mentioning the kind of PPE you're going to want to have, talking about personal hygiene for washing your hands and sanitizing and how that's going to look in the workplace, health screening. So we actually have, and Stella will bring this up later, but we actually have some screening questionnaires that you can use. You can do like a self-assessment, and so workers can then kind of go through the questions. We even do this now where we have a daily questionnaire that we go through if we're going to be actually going out and seeing a customer. We have to go through this checklist first, see if we have any of the symptoms, and if we say yes to anything, then we're supposed to let the manager know so that we can then kind of make alternative arrangements for who's going to see the customer, because we will not be allowed to do that anymore. We will have to stay home, I think possibly get tested, and then kind of go from there. So you're going to want to put things into your policies and procedures for the health screening as well. Surface decontamination, how often are you going to be cleaning surfaces throughout the day? Are you going to try and just do like some big cleans at the very end of the day, and then make sure that when you have kind of slower times during the day, you'll kind of do a quick wipe down with some other kind of sanitization products? Signage, so again, signage about having to wear a mask to go inside, signage about physical distancing, signage about, are you accepting cash at your business? That's something that people are starting to put up now. Some places don't want cash, they only want credit card or debit. So if you have a sign to state that, then going into the store or into the place of business, the customers will know that ahead of time, and that should hopefully keep people calm and be able to kind of have things run smoothly. So all sorts of signage is going to be necessary. Workplace training, this is sort of just talking about more training them with the PPE, training them with more like a refresher on harassment, workplace harassment. People have been locked up. This is a new kind of way of living. Some people might be a little agitated or irritated, and it might come out towards the employees that you have. So just reminding them how to handle that kind of a situation with your workplace harassment policies and how that works. you know, try to de-escalate the situation. If that doesn't work, bring the manager in, have them try to deal with it. If that still doesn't work, then you contact the police and have them removed from the premises. Going through that will help so that workers remember how it is supposed to go for the steps of how to de-escalate a situation and what to do. And it'll help to keep things running smoothly. And hopefully you won't have to deal with any of that, but you never know. So it's always good to have that refresher. Yeah, so basically your safe work procedures, your PPE procedures. So what is new about that? You're going to want to be having people wear face shields or masks or what have you. Don't necessarily worry about things like gloves. We'll get into this a little bit afterwards. Specifically for COVID-19, don't necessarily worry about gloves. There's been a lot of stuff coming out lately saying that it's actually probably more of a risk to be wearing the gloves than to not, just because there's that false sense of security. And then you could be actually transmitting it if you take the glove off wrong and you end up touching the outside and then touching your face, not thinking about it or what have you. So we'll get into that a little afterwards, but talking about your PPE and just kind of what it is you're going to have, how to maintain it, how to clean it, that kind of thing. You'll want to update that in your policies. First aid and emergency response. Now that we've got COVID to kind of consider at the same time, if someone does get hurt in the workplace, you're still going to need to perform first aid or have like emergency response. But there might be some different protocols that you have to put in place now to protect yourself while you are helping whoever got hurt. So what we have been suggesting at WSPS is talk to your first aid provider and see what they are suggesting from their specific point of view that you should do. For instance, with us, our provider told us that if we have to perform CPR, for example, we don't have to do the mouth-to-mouth part, we just deal with compressions. Other places might say, well, we have, you know, like a mouth guard or a mouth shield, so that you can put that on the person to protect yourself and give yourself a little bit of space while still performing the mouth-to-mouth piece of CPR. So see what they say, and then see if there's anything you have to add to your first aid kit from there. And that's how you would then update the kit. You would update the policy to say that, or the procedures to say that these are new things you have to put into place if you're performing first aid or emergency response. And then that way you're good to go. Workplace violence and harassment, we just kind of went through that. Just review that with them. You don't have to update anything. It's just about getting people to remember what the steps are. And then human resources policies. This is again about the self-assessments. If someone does get sick, what are you going to do? You're going to probably ask them to isolate, get tested, stay home for 14 days, that kind of thing. So you're going to want to update your policies for HR with those kinds of topics. And then you're going to want to deal with things like scheduling. So business hours might shift. You might decide that you want to start a little earlier and end a little earlier, or maybe start a little later and still end a little earlier, who knows, just to give you that extra time before and after to do the deep cleans before people start coming into your workspace. The staffing, that's going to be mostly about staggering breaks. So staggering your lunch hours, staggering your breaks so that you don't have too many people in that break room at one time. Again, trying to maybe have some people that work from home while other people work in the actual office or in the actual place of business. Those are going to be certain things that you're going to want to think about. I know some places have done staggered scheduling where certain employees are there, let's say Monday, Wednesday, and Friday, and then other employees come in on Tuesday, Thursday, and Saturday kind of thing. So you might want to just stagger who comes in at what point in the week rather than having everybody in there 7 days a week kind of thing. Cleaning and sanitizing, again, you're going to want to think about the scheduling for what kind of cleaning and sanitizing you're doing at what points during the day and how that's going to look. And then communicating that obviously to your staff so that they know exactly what they need to do and when. Signage is again about physical distancing, hand washing, harassment. You can flat out put a notice on your door saying, we will not tolerate any harassment. These are difficult times and we understand that, but we will not tolerate it. And that way, coming into it, the customers will know if they get a little irate, they're likely going to get kicked out. So that's kind of something else to put on there. Shirts, we have this more for anybody who has, like a uniform type of shirt with their logo. You might want to use that as your type of signage and make new ones that have something about physical distancing or wash your hands on the back of it. Some places have started doing that, not everybody. So it's just something that we've added in there as maybe you want to do this as an option. And then again, for hygiene, just keep people remembering that they need to wash their hands or sanitize their hands often, how the proper protocols for coughing and sneezing into your arm or into a tissue, throw it out, wash your hands. Airflow, try to keep your doors or windows open as much as you can, because the airflow really does help to refresh and hopefully help to eliminate a bit of the possibility of the virus being in your workspace. Cell phones, just try to wipe down cell phones, or if you have like walkie-talkies or anything like that, try to wipe those down as often as you can to keep them sanitized, and then washing your clothes a little more often, or again, if you have a uniform, maybe giving 1 or 2 extra shirts so that the wash loads aren't like every single day with the one same shirt. They have a few options for the week. And then finally, for administrative, you would be dealing with resources. So it's nice to have some links to certain websites or phone numbers for certain kind of areas, in case you have any concerns or questions that you don't necessarily know the answers to yet based on what's been said in the news. So things like thinkmentalhealth.ca is a really great tool for if there's any kind of mental health problems going on with your staff, in terms of, let's say there's anxiety going on about coming back to work while COVID's going on. They don't have anything specific to COVID, but they do have tips and tricks of how to kind of deal with the situation when an employee does have some kind of a mental health kind of issue going on. So it really helps you to walk through those steps and know how to recognize it, know how to walk through it with someone who normally wouldn't have anxiety, maybe has anxiety now because of COVID. And so knowing how to handle that will help you. So that's a really great resource. Having access to either a phone number or the website for your local health unit, to Health Canada, to your municipal or your township bylaw department. And then we say police here. That's more just try to have the phone number on hand easily, so that if a harassment kind of issue does take place and you do need to call on them, you're not kind of trying to quickly search for something. You kind of have it somewhere readily accessible so that you can call if you do need their assistance to get rid of someone that's being a little out of hand. The final control is going to be PPE. So this again is things like face coverings, face shields, goggles, N95 respirators. We're not really suggesting, because again, we're trying to keep those for health professionals in the hospitals. Gloves, as I mentioned earlier, we're really saying that gloves should only be used if it's something you are already using as PPE for a specific task to begin with. Don't just put them on to try and save yourself from COVID. That actually gives that false sense of security I mentioned earlier. Because you have them on, you won't necessarily think to wash your hands after you've taken them off, because you're thinking, oh, I had gloves on, I should be fine. And then if you take off the gloves in the wrong way, you could be touching the outside of the glove and then touch your face and then potentially end up catching COVID that way. So we really don't suggest wearing it. It could be a hazard as well, having them on when you typically wouldn't. It could get caught up on something and then you could get hurt. You don't want to risk that. So only use gloves if you were actually using gloves before for a certain task. That's it. Don't worry about the gloves for just to protect yourself from COVID. Body, we say aprons. That would be something like if you're in a dental office, have like one of those little disposable aprons that you can wear and then throw it out. That way the virus isn't getting caught on your clothes and then you're going from patient to patient to patient. It just kind of gives that little extra sense of security. But other than that, again, if you didn't normally wear an apron as a PPE, you probably don't need it again right now, but it is for very specific kind of businesses. And then PPE training. So you're going to want to train about the fit, the use, the care and cleaning of that PPE, how often it needs to be replaced, and what the limitations of that protective equipment has. If you need to know where to get the PPE, if you go to ontario.ca/PPE, there is a directory for suppliers, and you can find ones in your area that are providing what you need, and you can order from there. And then the final step for the RACE model is to evaluate. So you're going to look at the effectiveness of the measures you've put in place from all the other controls. You're going to have to look at this on an ongoing basis, because this is something that is changing all the time. So things might change in terms of the requirements or what will work, what won't work. Make the adjustments and improvements as you go. Make sure that no other hazards are being put in place because you've put these controls up. And then just, again, communicate with your staff, communicate with your customers throughout this entire process. That will be the best way to get through this as smoothly as possible. And I think I'm going to pass it on to Stella now.
All right, thank you, Vicki. So the Ministry of Labor Training and Skills Development inspectors have indicated that they're going to be focusing on a couple of things when they're visiting workplaces. So for example, how many workers are working in the workplace? What screening the employer has in place to prevent workers from getting COVID-19? Policies and procedures, what kind of things do they have in place for workers with symptoms of COVID-19 not coming to work? And how the employer is ensuring physical distancing, 2-meter separation between workers. How the employer is ensuring proper on-site hygiene, and other precautions including the use of PPE. Next slide, please. So the inspectors, and also remember that you need to focus on your existing health and safety program. So young workers are still are higher risk of getting injured during the job because they're less experienced and they may not have the same awareness of hazards and risks. So be sure that you pay extra attention to the orientation and observe their working habits. So certainly other things that inspectors are going to be looking at during the initiative is, is the workplace following Occupational Health and Safety Act and the industrial regulations. Do workers have health and safety awareness training? What about WHMIS? Machine guarding, safe work practices, health and safety representative and monthly inspections, and other applicable legal requirements. So the next few slides, we're going to talk about the resources that WSPS has available. So in partnership with Lear, we've created a pandemic playbook. And so the playbook lays out processes to raise awareness of new health and well-being protocols. It's a how-to guide to get Ontarians back to work. It provides general guidance and use in all workplaces, and it's an interactive playbook with active links. So some of the things that you'll find in the playbook are things like employer responsibilities, the hierarchy of controls that we spoke about earlier in the presentation, health screening, self-screening. Are you screening your visitors and contractors that come in? Isolation protocols, self-isolation and return to work protocols, physical distancing protocols, pathogen decontamination measures, cleaning high-touch surfaces, training and communication, so ensuring all staff are updated with the new protocols. And again, there's lots of active links and additional resources available. The next thing that we have available is our business pandemic preparedness checklists. So these are a great resource. These checklists are intended to be a self-assessment tool and assist you in wrapping up to regular business operations. The checklist includes additional links. So we have checklists available that are for businesses operating through the pandemic, businesses returning after shutdown of operations, and businesses returning to the workplace after working remotely. So checklists support and prepare you to reopen your business safely. Our COVID-19 guidelines and job aids. So in partnership with the Ministry of Labor, Training and Skills Development, along with our fellow health and safety associations, we've developed technical sector-specific guidance documents to assist employers as they prepare to reopen their business. These documents outline safety measures and should be followed so that workplaces can reopen safely for their workers, their customers, and the general public. I believe we have about 100 guidelines available in many languages like English, French, and Spanish. Our Small Business Center Safety Roadmap. So this is a one-stop shop for all your health and safety needs as a small business. And in addition to the small business roadmap, we also have a link to our COVID-19 resources available on the website as well. So we've actually broken down our small business roadmap into 3 sections. We have 1 to 5 employees, 6 to 19 employees, and 20 to 49 employees. So for example, if you were to click on the 6 to 19 employees, within these tabs, you'll find tools and resources that are available to you free. And so everything from safety checklists to duties and responsibilities, and the duties and responsibility really talks to you about the employer, the supervisor, and the worker. We have a health and safety templated policy already available for you, and information about posting requirements, as every business needs to have posting a health and safety board and posting requirements, violence and harassment, and etc. And so the safety checklist is a great resource to help you identify any gaps in your health and safety program. So it's a great starting point. And the safety checklist really takes you through every single category that you see on your screen. So it's a great website and a great tool, and everything there is absolutely free. So certainly check that out. And then we have our small business advisory service. So this is for companies that are less than 20 employees. The program is free for all participants who are selected. And basically what we do is we match the small business owner with a health and safety expert or a coach that can help you improve your health and safety with simple and easy solutions. It's 10 hours of free consulting, and it can be completed over weeks, over months, or even over the year. So if you're really feeling overwhelmed, which I'm sure a lot of business owners are, it's a great resource to look into. And finally, we have our duty consultant, which is our health and safety expert. We've extended our hours from Monday to Friday from 7 a.m. to 7 p.m. And you can reach our duty consultant by either giving them a call at the phone number on the screen or sending them an email at dutyconsultant@wsps.ca. They're handling questions, everything from COVID related to non-COVID related, one-off questions or many questions. So certainly reach out to our duty consultant if you have any questions or concerns. And then always remember to check our WSPS website. We'll continue to update our COVID-19 page with current resources. So thank you so much for joining us in our discussion today. We wish you well as you prepare for your business's reopening or ramping up to regular business operations. Thank you.
Well, thank you to both presenters today, Stella and Vicky. Very much appreciated. I'm sure there's a lot of people that weren't aware of the agency, the Workplace Safety and Prevention Services Organization. I know you folks have had a long-standing relationship with the Mississauga Board of Trade. Your offices are in Mississauga, even though you serve the entire province of Ontario. So we're glad you're home-based for us. Now, I don't see any questions from the audience yet, but I will remind you that the Q&A button is in the middle bottom of your screen, and if you do have a question, please don't hesitate to send it in. I will ask one that's more on a local level and then ask for your kind of interpretation of this. Mississauga City Council passed a bylaw last week that is now making the wearing of face coverings mandatory in all indoor public places. There is some confusion, and I'm not asking you to interpret the bylaw necessarily, but maybe to talk about some practical things that businesses can be doing with respect to that. We've unfortunately seen on the news already a couple of very unfortunate incidents that have taken place where customers have not wanted to wear a mask, and unfortunately have pit the business owner or the workers in the business against the customer for mandatory face coverings. And let's hope we're not going to see that going forward as more people get educated on the reason why this bylaw has been passed. When the enforcement takes place from the Ministry of Labor inspectors, one of the things that we talked about with the City of Mississauga bylaw enforcement officers and their public health officers was to take a public education attitude first rather than bringing down the hammer. So maybe you can give us an idea of what you expect. And I know, Stella, you talked a little bit about the Ministry of Labor inspectors that likely will be coming out to businesses to check on compliance, et cetera, issues. Can you give us a better sense of what that interaction might look like between the inspector and an employer, and perhaps a customer or even a worker within a workplace that is not complying with that kind of health and safety regulation?
Vicki, did you want to take that question first off, or would you like me to answer that?
Sure. Yeah, so basically, if it's being essentially mandated, or if it's being, like, I don't know if in your specific area, if it's considered Section 22, or if it's just kind of like a guideline that they want this to start happening. Because I know in some places it is flat out Section 22, and other places it's not. But it's still basically being mandated to wear the mask in a public space. So depending on that, essentially, what you can do if an employee is not wearing one when they should be, as the employer, the biggest thing to remember is, as the employer, you have the responsibility to protect your staff. So if a customer comes in and they're not wearing the mask when they're supposed to be wearing the mask, you have every right to turn them away. You have every right to tell them, listen, again, with the signage, you've got the signage, you're saying that they have to wear one coming in. So if you need to get Ministry of Labor involved for something going on, then they will take a more lenient approach in terms of they're not going to get the employer in trouble for not doing it, but they will give you suggestions on how to maybe enforce it a little bit more in your store, is kind of my understanding of it.
Yeah, and further to Vicki's comment, it's very unfortunate that we're seeing things in the news where you do have customers coming into supermarkets and workplaces and are refusing for various reasons not to wear a mask. So the proprietor or the small business owner or the owner does have the right to refuse service to that person. It's like having no shirt, no sandals, no shoes, no masks. It's the same policy. So you know, providing, I guess, the customers with information prior to coming into the workplace. So having signage at the front door saying masks are mandated and required, perhaps providing them as customers come in if they don't have one available, you know, offering the hand sanitizing, and just really encouraging that they take every precaution necessary to come into the establishment safely, is all we can really say. So and if things do get escalated, unfortunately, you know, the police do have to get called sometimes, or the Ministry of Labor, which is very unfortunate. So I hope that answered the question.
One of the challenges, of course, that we have from a Chamber of Commerce, Board of Trade perspective, is that we represent businesses in literally every sector of the economy. So someone that's a business in an office building is going to be a lot different than a factory, is going to be a lot different than a retail store. So often these guidelines wind up being confusing for businesses, because we talk about it at a high level, but then when it comes down to the practicality of actually mapping out your office space, or mapping out your store, and how things are going to flow and work, it can be a real significant challenge. And businesses that typically do have a lot of the general public coming into them are going to be a lot different than a business where all their employees can work from home and can continue to work from home, because they really don't need people back in the office. In all of the guidelines and all the resources that WSPS has on their website, etc., is it mapped out well into different sectors of the economy, so that you can go in there and look, and I'm a retail store, what's most relevant for me? Because what's relevant for me in a retail store is completely different than what it might be in a factory with 1,000 people, you know, assembling a car.
Yes, they're very sector specific. They are sector specific. So you can find something for a restaurant, you can find something specific to a retail store, you can find something specific to a warehouse. So they are sector specific to help with those guidelines a little bit more, and maybe try to unmuddy the waters as much as we can, even though everything's still kind of a question in the air for quite a bit of it.
Yes. Yeah, and I've attached some of the links in the webinar chat, so I'm not sure if you could see them. So yes, we do have guidelines and job aids that are very sector specific and provide, best practices and information, and just to help the business owner really put things in place to keep their workers, their staff, and their customers safe.
Okay, we've generated a couple of questions, so I guess I got the ball rolling. So we'll read what we've got and we'll let you respond. So certain regions state that if a customer has a health reason or cites human rights, they're not required to prove it to wear a mask. The question is it up to the business, or how will it be enforced when a bylaw enforcement officer enters, seeing a guest that has said they can't wear a mask for obviously certain reasons, medical or otherwise, and will that business be penalized? You can answer that from the province. I'm happy to give the answer from the City of Mississauga's bylaw perspective, because I was on a webinar with them earlier this week. So I can answer for the city if ladies, you want to answer from the provincial perspective.
Sure. So as far as I understand it, you should not get penalized for that. But because it's been stated that there are people that have health issues that they cannot wear a mask, and because it's being stated that they don't have to provide proof, it's hard to really penalize somebody for allowing somebody in when they've said that. All you can do is basically have, base it on faith of the person that they're being, true, and not just saying that for the sake of not wearing a mask. But it is up to the employer to decide what they want to do with that. So if someone says, I have a health condition, I can't wear a mask, it's up to the employer to decide, okay, well then you can't come in here, or okay, I will allow it, come in, but these are going to be the other kind of protocols we're going to ask you to do to try and at least eliminate some of the risk in different ways other than the mask. That's how I understand it. From the provincial level, I don't know for your localized kind of level.
So from the perspective of the City of Mississauga's bylaw, I can answer that, because the Director of Bylaw Enforcement, Sam Rogers, was asked this very question on Monday on the City of Mississauga's webinar on the mandatory face covering bylaw. The answer is, if an individual simply states that they cannot wear a mask for their own health or personal reasons, you cannot mandate them to have to wear a mask, and bylaw enforcement will not take any action. So there will be individuals, whether they're your customers or your employees, that may say that they cannot wear a mask for whatever reason. I'm sure most of them would cite a health issue. You cannot enforce the mandatory face covering bylaw in that particular circumstance, and the bylaw enforcement officers will not take any action.
So very similar to the provincial one.
Yeah, that's from a Mississauga perspective.
Right.
So our next question is there a mechanism that's in place relating to this square footage, I guess, of your business operation to determine the number of people that are allowed to be in your place of business, taking into consideration a safe working configuration of space? I get this question quite a bit. In particular, I get it from restaurants who are now preparing for stage 3, hoping to be able to have people physically inside. Right now it's just patio service, as we know. When you move into stage 3, you get into indoor seatings. It seems there's a lot of confusion around square footages and numbers of people versus this practice of just making sure you have appropriate physical distancing. So are you aware of any guidelines that there are around the relationship between number of people in a business and square footage? Or is it just kind of that general, as long as proper physical distancing is being maintained, then you're basically in compliance? Right.
So there is actually a guideline for this. I don't Unfortunately, I can't remember the exact numbers. So hopefully maybe Stella or I can try and find that guideline and send it to you to send out to everybody for the specific numbers. But there is a guideline for the square footage. It's something like, I think every 2 square feet or 4 square feet for X amount of people or something like that. So we'll try and get the exact numbers for you and send that out. But there is the guideline, and you have to, in this, you do still have to consider the furniture, the aisles, the shelving within that kind of spacing, which has been part of what makes it so confusing, because you still have to consider that within the distancing. So you're trying to keep the 6 feet apart within that space, but then there's still like 2 shelves in the way or something like that. So we'll try and find that link for you and forward that off. But there is a guideline for it.
Yes, there is a guideline. I think Vicky was right. I think it's 4 square meter for each person.
Yeah.
And I think ontario.ca, if you visit that website, or publichealthontario.ca, they certainly have a formula for that.
Okay.
But I think it does come down to it as well. As long as there's proper physical distancing, everyone's keeping their proper spacing of 6 feet 2 meters, both in restaurants and in retail stores. I don't think that the ministry or anybody would have a problem with that.
Well, listen, thank you very much. I want to remind all of our viewers today that go to the WSPS website. The resources are outstanding. I've been on it several times since all this has happened. So remember, those are free resources available for you as business owners and operators, both for your customers, your business, and your employees, to protect proper health and safety. This has been very helpful. We're very fortunate to have an agency like Workplace Safety and Prevention Services that are there to provide leadership and guidance to us especially during this time, but just in occupational health and safety issues generally, as they do each and every year. So just a couple of housekeeping items for folks on the line. We have a few events coming up. We have our next webinar on July the 23rd, entitled Let's Talk About Managing Our Mental Health. Certainly this has been an extremely stressful time for both employers and employees as it's related to the COVID-19 pandemic and getting back to work and dealing with all of the fallout of the difficulties that we've had over the last number of months. On August 12th, we'll have our virtual Good Morning Mississauga networking event. So there's still a few speaker spots. If you're interested in that, make sure you contact the MBOT office. August 17th, we are going to have a golf tournament. Now, it's going to look a little different than what you're used to in the past, but we've had so much interest from our members in wanting us to do a golf tournament this year that we are running one on August the 17th at Lionhead Golf and Country Club, and we will be practicing appropriate physical guidelines, etc., that have been established. So the tournament will be a little bit different than what you're used to, but at least you can get out and play a bit of golf and see a few of our friends and colleagues in the industry. So there's information on our website as to how to register. Nominations are also open for our 2020 annual business awards, taking place on November the 14th. You can nominate your own business or another business that you're aware of, and those nominations are open until August the 31st. So again, on behalf of the Mississauga Board of Trade, I'd like to thank our friends from the Workplace Safety and Prevention Services for joining us today and presenting on the work that they are doing to support businesses in the province of Ontario. I want to special thank you to everyone who joined us today, and many of you have over our series of webinars, which we're going to continue to do, and we look forward to seeing you on future events. So at the end here, I want to wish everyone a continued healthy and safe workplace and wish you continued success in your business.